Hello viewers, welcome back to our channel. Today we'll be discussing one of the most important things, the topic in public health, which is hepatitis. This viral infection affects millions of people worldwide, but unfortunately there are still many myths and misconceptions surrounding this. In this session, we'll be clearing up some of the myths and providing accurate science-backed information to help you understand hepatitis better. So let's dive right in. First, let's quickly review what hepatitis is. In our previous video, we've talked about the causes and everything, but we just give a little recap. Hepatitis is an inflammation of the liver often caused by viral infection. There are five main types of hepatitis viruses: A, B, C, D, and E. Hepatitis A is usually contracted through contaminated food and water. Hepatitis B and C are primarily spread through contact and infected blood or body fluid. Hepatitis D only occur in people who already are infected with hepatitis B. And hepatitis E is primarily spread through contaminated water, much like hepatitis A. While some people recover from hepatitis without long-term issue, others can develop chronic liver disease, which may lead to cirrhosis or liver cancer. Now that we have reminded ourselves what hepatitis is, let's move on into the myths. And the first myth we'll be talking about today is hepatitis is only caused by alcohol. Well, while it's true that alcohol abuse can lead to a form of hepatitis called alcoholic hepatitis, the majority of hepatitis cases are caused by viruses, not alcohol. Hepatitis A, B, C, D, and E are all caused by specific viruses, and each has its own mode of transmission. So it's not all about alcohol. It can be caused by other viruses. So if you have hepatitis, it's important for you to know whether it is caused by alcohol or a virus, as this will influence your treatment and recovery option. The second myth we'll be talking about is you can only get hepatitis from sharing needle. Why sharing needle or other drug paraphernalia is a high-risk behavior for contacting hepatitis B and C. It's not the only way the virus spread. Hepatitis B and C can also be transmitted through unprotected sex with an infected person, receiving contaminated blood products, though it is rare due to improved blood screening and of blood donations, but it still do happen. From mothers to baby during childbirth, we've talked about that in one of our videos. You can check our channel and see pregnancy and hepatitis and pregnancy. And it can as well be transmitted through using unsterilized medical equipment in some countries, which doesn't have good sterilization procedure, or some rural settings which don't have good sterilization procedures. So while needle sharing is a high-risk activity, it is not the only way to contact these viruses. Taking steps like using protection during sex, ensuring safe medical practices, and getting vaccinated can significantly reduce your risk. Now let's talk about another common myth. Hepatitis is a chronic condition for everyone. That's not absolutely true. This is not true for all types of hepatitis. For instance, many people who get hepatitis A recover fully within a few months without long-term liver damage. Similarly, hepatitis E typically resolves on its own. However, hepatitis B and C can become chronic if left untreated, and these are the forms of hepatitis that are most likely to lead to long-term complications like cirrhosis and liver cancer. We talk about different complications of hepatitis in one of our videos. You can check through our channels and watch it later. While it's not everyone that gets hepatitis that will develop chronic disease, it's important to get tested and treated early to prevent long-term liver damage. That is the goal. Now let's talk about another myth. Hepatitis B and C have the same symptoms. That's not absolutely true as well. While hepatitis B and C share some similar symptoms like fatigue, jaundice, and abdominal pain, they are caused by different viruses, and they can have different long-term effects. Hepatitis B can lead to cirrhosis and liver cancer, but hepatitis C is known to be a leading cause of liver disease and liver transplants. So both have their own issue. They have their own issue. The symptoms can overlap, but because they are different viruses, the treatment approaches for hepatitis B and C are also different. Hepatitis B has a vaccine available, while hepatitis C can now be treated with antiviral medication. Now let's address this very important one, that there is no vaccine for hepatitis C. That is true that there is no vaccine, but it can be treated. Unfortunately, there is no vaccine for hepatitis C as of now. However, hepatitis C is treatable with antiviral medication, which can cure most cases when taken correctly. Unlike hepatitis B, which has a vaccine, the focus of hepatitis C is on early detection and antiviral treatment. While a vaccine would be ideal, modern treatment for hepatitis C can effectively eliminate the virus from the body in many cases, making it manageable and curable. Another myth is that only people who inject drugs need to worry about hepatitis B. This is another misconception. Hepatitis B can be transmitted through many forms of contact, which include coming in contact with infected body fluid, including sexual contact, and from mother to child as well during birth. Even tattoo or piercing with unsterilized equipment can be a risk factor. So it's not only those that share needle or inject themselves that need to be worried. Anyone can be at risk of hepatitis B, which is why vaccination is recommended for all infants, people who are at higher risk, and anyone who hasn't yet been vaccinated. Ask yourself, have I been vaccinated? If you have not been vaccinated, go get tested and get vaccination. And our last myth today is hepatitis can be transmitted through hugging. Oh, there is a big misconception. Hepatitis cannot be transmitted through casual contact, such as hugging, kissing, or shaking hands. The hepatitis viruses A, B, C, D, and E spread through specific routes, such as hepatitis A, primarily spreading through contaminated food or water or close contact with an infected person fecal-oral routes. Hepatitis B spread through contact with infected blood or body fluid, including sexual contact, sharing needles, or from mother to child during birth. Hepatitis C mainly spread through blood-to-blood contact, such as sharing needles or receiving contaminated blood products. Hepatitis D only occur in people already infected with hepatitis B and spread in similar ways to hepatitis B. Hepatitis E primarily spread through contaminated water. So hugging or other forms of casual interaction are not ways you can contract hepatitis. The viruses require specific routes of transmission to spread. In conclusion, hepatitis is a serious health concern, but there are many misconceptions about how it spreads and how it can be managed. By understanding the facts and getting vaccinated, we can all keep ourselves protected and our loved one as well. Remember, if you are unsure about your hepatitis risk, speak to your healthcare professional. Testing is key, and early treatment can make a big difference. Thank you for joining us today and staying informed. Let's work together to dispel myths and protect our health. Don't forget to like and share this information with your friends and family to keep them informed. And click the subscription button, then turn on the notification knob so that you can know whenever a new video is being posted. Thank you.